Digestion, mental wellness, and the condition of the body's organs are all impacted by gut health. Red wine can help the intestines when used in moderation. Red wine has polyphenols and antibacterial qualities that assist maintain a healthy balance in the natural microbiota of the gut. Treatment and prevention of a variety of illnesses, such as autoimmune diseases, breast cancer, and other malignancies, obesity, and inflammatory bowel disease, depend on having a diverse microbiome. Hey people, welcome back to our channel. In today's video, we will be looking into the health benefits of red wine. But before we start, make sure to subscribe to our channel, turn on the notifications, and most importantly, watch the video till the end. Let's get started. Consuming red wine in moderation can improve overall heart health and provide some cardiovascular advantages. Red wine's polyphenols have a vasorelaxant impact on the coronary microvessels. These organic substances support healthy red blood cells, blood clot avoidance, and other cardiovascular disorders. Additionally, red wine can increase lipoprotein or good cholesterol levels. Cardiovascular disease is better protected against when HDL levels are higher. Procyanidins, which are found in procyanidin-containing tannins found in red wine, can prevent heart disease. A glass of red wine each night can lower high blood pressure. Alcohol can interfere with the body's internal schedule, making it harder to fall asleep. Higher alcohol consumption might cause short-term withdrawal, which can increase sympathetic activity and disturb sleep, especially in the second half of the night. For some people, a glass of red wine every now and then may improve their mental health and prevent the onset of depression. But binge drinking raises the likelihood of developing depression. Red wine, almonds, cranberries, blueberries, and grapes contain resveratrol, which has been related to anti-aging benefits. It promotes general health and activates the anti-aging pathway, which extends longevity. Depending on how much alcohol is drunk, several advantages may be experienced. These possible advantages are less likely to be felt by heavy drinkers. A glass of red wine each night can help control and prevent diabetes. Drinkers of moderate amounts of wine have a 30% lower risk of type 2 diabetes. For the majority of diabetic patients, one glass of red wine every night is safe. It is not recommended to drink excessively or to finish a complete bottle. The Annals of Internal Medicine study reports that a group of people with type 2 diabetes were instructed to consume a glass of white wine, red wine, and water each night. The participants had been eating a Mediterranean diet for 2 years and were at low risk for alcohol consumption. The findings showed that those who regularly drank a glass of wine had higher HDL cholesterol levels and higher quality sleep than those who exclusively drank water. Regular alcohol use can increase a person's risk of getting cancer. Red wine is an exception to the rule, though. Consuming red wine in moderation is associated with a decreased risk of breast cancer. In premenopausal and postmenopausal women, the skin of red grapes contains compounds that assist raise testosterone levels and lower estrogen levels, which can lessen the risk factors for breast cancer. Intoxication and a sensation of mental fogginess might result from consuming too much wine. We recommend having just one drink. A daily glass of wine can help prevent blood clots from forming in the brain. Stroke risk is reduced in people who drink wine in moderation, limiting themselves to 1 or 2 drinks per day, comparatively to people who only drink seldom or never. Consuming 4 or more drinks a night can up your risk of stroke. Red wine not only prevents blood clots but also lowers the risk of dementia. Compared to heavy drinkers and abstainers from alcohol, moderate drinkers are less likely to develop dementia. Health professionals advise against starting to drink if you already abstain from alcohol. However, it can be good for a person's health if they go from excessive alcohol consumption to moderate red wine drinking. Red wine contains resveratrol, which guards against blood clots and damage to blood vessels. Additionally, it aids in reducing the likelihood of inflammation, which can result in heart disease or a heart attack. Flavonols, which are substances that aid in defending the body cells required for sustaining blood arteries, are abundant in wine. This physiological benefit enhances both brain blood flow and general brain function. Additionally, It stops dangerous plaque from forming. When consumed in excess, alcohol can be dangerous. Large alcohol intakes or binge drinking are linked to adverse health effects. Numerous health issues, including pancreatic and liver illnesses, heart disease, diabetes, malignancies, and unintentional injuries, can be brought on by excessive alcohol consumption. Additionally, it may cause concerns with mental health, immune system deterioration, and weight gain. Moderate wine consumption has positive health effects. However, binge drinking has the opposite effect. Pregnant women, minors, and anyone taking certain medications are among those who should refrain from drinking alcohol or stop altogether. A bottle of wine a day or more than a few drinks per day can harm the liver and cause disease or liver damage. The health benefits of red wine are the subject of the majority of studies, while those of white wine need more investigation. Recognized for having a high resveratrol content, red wine contains 10 times as much as white wine. Resveratrol, a potent substance that assists in protecting blood vessels and preventing blood clots, is present in greater quantities in red wine than in white wine. These substances boost levels of good cholesterol and support blood pressure control. Red wine contains polyphenols, which are substances that help fend against the consequences of premature aging. Therefore, 1 or 2 drinks every day can help you look youthful while keeping pollutants at bay. Red and white wine have similar amounts of calories. A glass of red is about 130 calories, compared to about 121 for a glass of white. A typical bottle of wine has about 650 calories, with sweet wine varietals having more calories. Red wine can help strengthen bone density and lower the risk of osteoporosis because it contains more silicon than white wine. Overall, red wine is better for your health than white wine. Both varieties of wine include alcohol, and heavy alcohol use increases the chance of developing health problems. Regardless of the health advantages of red wine, it should still be drank in moderation. Daily wine consumption can contribute to a healthy lifestyle. It can, however, have a detrimental effect on both physical and mental health if ingested in excess. It's critical to comprehend the dangers of excessive everyday alcohol consumption. Sure, when you unwind with a glass of wine at the end of a hard day, you may have noticed the anecdotal effects of this, but the stress-relieving properties of wine have been studied. Many of red wine's anti-inflammatory properties can be attributed to a substance called resveratrol. According to 2019 research published in the journal Neuropharmacology, resveratrol may have anti-stress properties by inhibiting brain enzymes that cause depressive and anxious-like behaviors. 1 glass of wine per day for women and 2 glasses per day for men was linked to a 32% decreased incidence of depression, according to another evaluation of research. There is good news and bad news regarding the relationship between wine intake and the risk of cancer. The good news is that moderate wine drinking may offer some protection against gastric and esophageal cancer. Another recent study discovered that drinking modest amounts of wine may reduce thyroid and kidney lymphomas. However, the same study also discovered that moderate alcohol use may raise the risk of breast, liver, prostate, and pancreatic cancers. According to other research, even 1 drink a day can increase estrogen levels, which are known to be a risk factor for breast cancer. Although drinking wine every night has been a tradition for ages, more research is necessary before we can tell with certainty how it may affect your health. There may even be some health benefits if you enjoy it and stick to the suggested intake levels. However, if you don't drink, these possible advantages aren't a good enough excuse to start. It's crucial to remember that leading a healthy lifestyle overall, one that prioritizes a balanced diet, regular exercise, and social interaction, is the best way to maintain your general well-being. It's unlikely that your nightly glass of wine will make or break you. With that, the video has come to an end with that. Let us know what you think in the comments section to help us expand our community and attract more people who share our interests and are eager to learn. Please hit the like button and subscribe if you thought the video was interesting. Till then, bye.